The reason for this insufficient cervix is usually because the cervix is weak, and it can be weak due to maybe you've done previous pelvic surgeries for maybe fibroids or something else really, and then it causes your cervix to be weak. But sometimes there's really no reason. Some women just have weak cervix. So in that case, what we do to prevent her from further pregnancy loss is to do a cervical circlage, which is simply putting a little stitch. Today, I'll be reacting to Facebook TTC groups and the conversations that go on there. If this is the kind of content you're interested in, keep watching. And if you're new to my channel, I'm Dr. Amarachi Ijeoma. I am a fertility physician, and my channel focuses on everything fertility and women's health. So keep watching. So someone asked in the comment section, before I always see this muscle during ovulation, but I'm not seeing it again. And then someone responded, treat infection with your husband and change your underwears. So it's kind of like the question is a little bit confusing for me as well, because seeing muscle during ovulation, I'm assuming is blood bleeding during ovulation, and maybe it clots when it gets to the underpants and the clot of blood looks like a muscle. Well, I'm assuming this is what it is. And if this is what it is not infection. So there's no reason you should just go and treat infection with your husband. It is pretty normal to bleed during ovulation. Some women experience this. And the reason is, just before ovulation, the hormone called estrogen rises, and it makes the lining of your uterus, the inner lining of your uterus, to be thick. And this is because it is preparing your uterus for implantation, for pregnancy. So just before the ovulation occurs, there's a slight drop in the estrogen just before it recovers. And this slight drop can affect the lining of the uterus and can cause you to bleed. It's usually more like spotting. When you experience ovulation bleeding, it doesn't affect your chances of conceiving. It doesn't affect your chances of getting pregnant. So there's nothing, it's not infection. If you feel like you have infection, if you have other symptoms, maybe pain during sexual intercourse or abnormal color of your vaginal discharge, maybe greenish, yellow greenish, go to the hospital, get tested, get evaluated so that you find the exact infection that you have. But for ovulation bleeding, it is not a problem. It is normal. Okay, so this one says, can injection be taken to close open cervix at 5 months pregnancy? So what the person is really asking is, what the person is referring to as open cervix is something we call cervical insufficiency, formerly called incompetent cervix. That is when a woman experiences loss of pregnancy between 14 weeks gestation and 20 weeks gestation, and she experiences this loss 3 times consecutively. Most times, the cause of this is incompetent cervix. That is, the cervix, the neck of the womb, is opening, is dilating before 9 months, before term. Sometimes, the reason for this insufficient cervix is usually because the cervix is weak. And it can be weak due to maybe you've done previous pelvic surgeries for maybe fibroids or something else really. And then it causes your cervix to be weak. But sometimes there's really no reason. Some women just have weak cervix. So in that case, what we do to prevent her from further pregnancy loss is to do a cervical circlage, which is simply putting a little stitch, to hold the cervix together and prevent recurrent pregnancy loss. So it's not an injection, it's a stitch. It's a little procedure that is done. So someone said, if you have lost your ovulation, order for the herbs 6,000 naira. But if fibroids, cyst, fallopian tube wahala, infection, etc. are inconclusive or are inclusive rather, then you will add small money on top. Very effective, and people are testifying. Note, no ovulation, no conception. When your fallopian tubes are also blocked, conception cannot take place too. When you have fibroids or cysts, conception will be difficult. If you've been following my Facebook reaction videos, by now you will know that these are the kind of comments you should run away from when you see it. When they start telling you to pay for something and then it will cure this, that, start running. There are many reasons why you can stop ovulating. So many reasons. One of which is high prolactin level, another one is PCOS, another one is premature ovarian failure, another one is excessive weight loss, another one is excessive exercise, another one is being underweight, another one is being overweight. There are a lot of reasons. Just go to the hospital. And for each reason, there's a particular treatment. For each reason, there are different treatments for each and every one of them. So somebody that is telling you, just come and take this drug. You're having irregular periods, or you're not even ovulating. Come and take this drug. Take it, you'll be fine. You'll start ovulating. Then you should know that there's a problem, because the person did not even ask you any question. Are you having abnormal breast discharge? When last did you see your period? And certain other questions, even questions like, are you experiencing vision loss or something? There are so many questions to be asked. I can't overemphasize on going to the hospital to get tested, to get evaluated by a doctor, and then getting properly treated to restore ovulation. I've done a video that is currently on my page where I talked about so many causes of, anovulation, which is not ovulating, and how to treat them. If you're interested in watching that, I will put the link in the comment section below. Okay, someone asked, please, what is the permanent solution to PID and infection? And the response was, natural herbs will cure you completely, and make sure you treat it with your husband and change your underwears. And then there's this picture of 2 gallons of herbal concussion with the name Natural Cure for PID Infection. Run. I'm saying this because PID is a serious concern, is a serious gynecological concern, especially if you are a woman of childbearing age. Reason is that it can be complicated by infertility. And the idea is to treat early. Once you feel like you have PID, in fact, you can't feel like you have PID. You have to go to the hospital to get tested. What are the symptoms to look out for? Sometimes there are no symptoms. So it's usually gotten from sexually transmitted infections. And these infections, when they're not treated, they travel up into your uterus and into your fallopian tube and cause havoc there. And that's where all the problem starts from. So when you have symptoms, the symptoms can include severe lower abdominal pain. Sometimes you notice it when you're having sexual intercourse. Sometimes when you're having sexual intercourse, when the penis has penetrated deep into the vagina, you experience pain during sexual intercourse. And then sometimes, depending on the organism that caused the PID, you could have greenish discharge, you could have yellowish greenish discharge as well. So you want to get tested for the exact organism that is causing the infection, and then get treated, the appropriate treatment for it, which is, like I've said, antibiotics, which you have to complete the course of it for the period that you're supposed to take it for. Okay, so I'm a little confused about this one because it's a women group, but then the letter is to men. But let's see what the message is all about. Dear men, remember how beautiful, smooth, and sculpted her body was at the beginning of your marriage. She is still the same woman with the same spirit that you have always loved. The difference is that she gave your children life. The price for that was the loss of the body she once had. Do not complain about your wife because her fat increased, and do not think that she likes it. A mother's affection makes her turn a blind eye to all of that, and her only concern is her children and your happiness. Remember that this tummy was once the warm home who hugged your children for 9 months. With all their pain, fatigue, and weight to seal them until childbirth. Please, men, always appreciate your wife. It's not easy to go through this journey for 9 months. I agree with a lot of what she said. Like a lot of truth in one post, actually. Stretch marks are natural. When a woman is pregnant, her uterus, that is usually small and sitting in her pelvis, starts to grow a baby. A baby starts to grow inside of it. And because of that, the uterus distends and keeps progressing like that till 9 months, yeah? So it gets all the way to her abdomen. And then it gets bigger. So the skin starts to stretch to accommodate the growing uterus. And then by the time she And then by the time she delivers the baby, there's nothing else in the uterus again. And then the uterus starts to involute back into the pelvis. And she has like excess skin, she has stretch marks, which is all natural. It is a normal part of pregnancy, delivery, childbirth, everything, and it's beautiful. It's part of what makes women women. It is like battle scar. It's beautiful. I mean, this is a beautifully scripted advice to men, except that men are not on this group. So hopefully the men that are watching this will tell the other men, you know. So yeah, it's a pretty solid advice. So I'm going to be ending today's video here. If you found this video informative and you want more content like this, subscribe to my channel, like this video, share with your friends. And if you want more content like this, press the notification bell below so you can be notified whenever I post a video. And see you in my next video.